Hi, everyone. Good morning. Today, we're joined by Dr. Tony Laskey, the Division Chief of Child Protection and Family Health for the University of Utah Health and the Medical Director for Primary Children's Hospital Center for Safe and Healthy Families. April is Child Abuse Prevention Month, and today we're going to be having a discussion around this potential hidden epidemic that's been happening during the COVID pandemic. Dr. Laskey, thank you so much for joining us. It's nice to see you.
Thank you for having me.
So I'd like to start off with just some data and information around child abuse in the United States and Utah, just to kind of set the framework for this discussion.
Sure. So child abuse is a problem that affects all communities across the United States, including here in Utah. For April, which is Child Abuse Prevention Month, we put a display of pinwheels at Primary Children's on the front lawn, representing the 1,800 children that were killed at the hands of a caregiver last year, last year that is reported. So 2019 is the most recent statistics that we have. Child abuse happens at a rate that is alarming, given that it's completely preventable. And we know that each year there are millions and millions of children who are reported to the Child Protective Services around the country. Last year alone, there were again, the last reported year, 2019, 4.4 million children cases were referred to Child Protective Services, involving 7.9 million children nationally.
Wow, that's a really alarming statistic and something I didn't really expect to hear. You mentioned too that we are seeing this data from the year 2019. When does the data for the last year typically come out? What's the delay in that typically?
So the way the data is collected is through a national database that's reported to the federal government. And it's required as part of a law called CAPTA, which is the Child Abuse Prevention and Treatment Act. So each state is required to report data for their fiscal year. That gets reported to the federal government, who then has to compile and synthesize it. So typically there's a 6 to 8 month delay for the prior year for that data to come out. So the 2019 data was released just a few months ago, if I remember correctly. So we won't be seeing the 2020 data, which of course is of great interest to us to try to understand what was happening during the COVID pandemic.
It kind of leads to my last question. This time last year, the states were starting to shut down, schools were going to remote or were not doing anything in person, and people were kind of becoming isolated in their homes. How did the pandemic shutdowns affect child abuse trends in Utah from what we know so far?
Well, both in Utah and nationally, we really experienced an interesting phenomena that child abuse pediatricians hadn't experienced before. So case rates are somewhat stable wherever you are. You sort of have the same amount of cases come in to your outpatient clinics or to your emergency department, or that have to be admitted to intensive care units. So those rates are remarkably stable year to year. And then when the pandemic hit, all of a sudden, it seemed like the floor dropped out. We weren't having any cases coming into clinic. And clinic usually involves sex abuse cases and physical abuse cases that aren't serious enough to require hospitalization. Now, it's really important to remember all child abuse is serious. So when I say not serious enough, it doesn't diminish the significance of the harm that happens to a child who's hurt at the hands of a caregiver. I just mean that it wasn't bad enough that it required emergency evaluation or admission to the hospital. So across the country and here in Utah, our clinics got really quiet, which was frightening to us because we know that child abuse doesn't just go away. I mean, if it were that simple, we would have solved this problem decades ago. So the reality is that for some reason, when the country shut down, we stopped seeing cases, and that really concerned us. Now, the cases that were very, very serious, that needed hospitalization, that needed to be in an intensive care unit, those were quiet for a short period of time, and then those came back. So the reality is that we believe that children were at home and didn't have the safety net that was normally in place, which is the schools and the other people in their lives that they would have as safety nets, like their churches, like their sports activities. So when you had children who were either being sexually abused or physically abused, nobody was seeing it, so they weren't able to get the care that they needed.
There was a lot of reports too around domestic violence increasing in Utah specifically last year at the beginning of the pandemic and throughout it. Do you feel like this could lead to an increase of anything related specifically to child abuse? Is there ever a correlation between the two, or what's the impact of that on children in the home?
Yeah, the impact of interpersonal violence is really significant. And what really worries us is we know that cases of domestic violence were going up substantially during the pandemic. We know that intimate partners were engaging in violence at a rate that we hadn't previously seen. And we know that children that are in those environments are at both physical and psychological risk. The reason they're at physical risk is the so-called crossfire victims. It is not unusual that children are harmed between when two adults are having physical combat. Sometimes it's because they are trying to protect a parent. Sometimes it's because they're being held by the parent when something is happening to them. Sometimes children are hurt as a way of hurting the other parent. So children that are in an environment where the adults in their home are engaged in domestic violence, they're at substantial risk for physical harm themselves. But it's really important to understand that the psychological harm that comes to a child who is witnessing domestic violence, either just by hearing it or seeing the after effects of it, the consequences are lifelong. So we know that children, if rates of domestic violence were going up as much as they were, and we know that children were in those homes and weren't even able to get out and go to school or go to church or go play with the neighbor children, we know that they were being exposed even more than they previously had been, which really worries us about the harm that's come to them.
Yeah, I think it's interesting to you can bring that correlation together and kind of see how it would make sense that this is happening, which is really sad to hear. As Utah has kind of returned back to a normaler state, we reinstated in-person learning. I think it was in like September. Some schools went back in January. Have we seen an increase of patients coming into our clinics now that those have kind of lifted a little bit? Are you starting to see more people who are coming in?
Yes, for sure. Schools are a true safety net for children. We know that teachers and counselors and other children at school provide an outlet for children to talk about things that have happened to them. And the vast majority of reports that come into the Department of Child and Family Services actually come from educational settings. So the fact that children are back in that environment, our rates are returning back to what we had previously experienced with clinic appointments and things like that. Likewise, sexual assaults between teenagers are going back to their normal rates because as children aren't locked down anymore and they're out and they're socializing with their friends, we're seeing more of those types of evaluations also coming in.
So it seems like a lot that happened during the year of 2020, the responsibility of reporting anything that we saw, whether it was domestic violence or child abuse, kind of fell on the community since they didn't have the safety nets that we normally have. What should people be looking for, and when is it significant enough for someone else to start reporting these to someone?
So it's important to recognize that in Utah, everyone is considered a mandated reporter. And what that means is that we all have a legal obligation, which is completely aside from the moral obligation, really, to speak up on behalf of children. When children have something like this happening in their life, they need an adult to help them. And the reality is that adult is often somebody outside of their household because abuse often happens in the home. So if a child were to disclose to you that they had been experiencing sexual abuse, it's really important to believe them and to take action. It's not anyone's job to investigate except the investigators. So if a child were to tell you that somebody's been doing something, making that report to DCFS allows the system to appropriately respond and figure out what was it that happened, is the child safe, and how can we get them the help that they need. With physical abuse, if you hear things, I can't tell you the number of cases that we hear about where a neighbor actually heard somebody physically harming their child, hitting them, the child screaming and crying, and nobody said anything. Those children can go on to be so physically injured that they end up needing hospitalization. And in a worst case scenario, they can actually be killed. So if you hear something that causes you to worry that that child's not safe, it's important to call DCFS. And again, it's not a person's job to investigate. That's law enforcement and child protective services. They're trained professionals that do this. And honestly, having somebody just make sure the child's okay isn't going to get that child removed from the home if nothing's happening that's dangerous or against the law. So I encourage people to be the voice that children need if they hear something, to say something.
You brought up an interesting point around if someone is reporting it, that the child might not actually be removed if nothing comes of that investigation. I've definitely heard people are nervous about reporting anything that they hear due to that situation happening, or their neighbors misconstructing what's happening, or some sort of other altercation happening because of it. What are some encouraging things you could tell those people who want to report this but are really nervous about doing so?
The way we talk about making a report to CPS is an analogy in the medical world is it's a screening test. So for example, if you had a sore throat and you went to your doctor and they were worried that you had that you might have strep throat, they would swab the back of your throat and they would send it for a quick test that would tell you the answer, yes or no. But then they want to make really sure that the answer is correct so that they put you on the right medicine to take care of that. So then they send it for a better test. And that better test involves more things that have to be done. And that's what we do to confirm that it's actually what it is. So very much like that, if you were to call CPS and CPS were to investigate, that's the more detailed test. They're putting a lot of resources into talking to the child, talking to the family, talking to other people that know about what's going on, sometimes getting medical help if necessary. And that way we can figure out which ones really need help and need intervention and which ones were a misunderstanding or something completely different. So it's important to recognize that making the call doesn't mean that you're saying for sure that abuse has happened or for sure that the quote unquote, the parents are bad. What you're doing is you're getting a child help from somebody who can help figure out, what does this family need? What does this child need?
Should you ever confront the parents or whoever about something, if you happen to see it happening, should you put yourself in that situation to get involved?
That's a difficult case because I think that it is not unusual that somebody would experience, for example, watching a frustrated parent and have a toddler have a meltdown at the grocery store. I mean, I think we've all seen that. And I was on a plane once, and a mom was getting just increasingly frustrated with a toddler who clearly was tired and wanted to be up and running around, and she was getting really angry to the point that you could tell she was going to spank this child. And things can get out of hand even for great parents, because being a parent is hard and it's frustrating. So having somebody in certain situations be able to say, oh gosh, this is so hard. As a, I remember when my kids would do that, I just being able to distract somebody in the moment, and saying something kind and helpful, can be positive and can intervene safely on behalf of a child. However, it's also important to recognize that it's not your job to put yourself in danger. Making a call, if you believe a child is in immediate danger and that there's a potential threat to their health and well-being, calling law enforcement, calling 911 is the right answer, and not putting yourself in the middle. But there has been some research that suggests just being able to say something kind to a parent who's experiencing that really, really frustrating situation can be supportive and can actually divert what was going to happen.
That plain example is something that happens all the time. And I think it's really important that, yes, it might be frustrating to you, but imagine what the parent themselves is going through trying to calm down their child. They know that everyone is looking at them. So if you can
Right.
offer those words of encouragement, it probably goes a lot further than you scuffing at them or like making a comment that's not helpful. So that's a good tip to remember.
Yeah.
Is there anything else you'd like to mention to us around this month, or what people can do to get involved or to learn more about resources that are available in the community?
Sure. I think a really important resource that people should know about is the Children's Justice Centers. Utah has a really great program that is community-based, and we have centers in 26 of 29 counties where children have a safe place to be cared for if they've been abused in some way. So Children's Justice Centers are a resource where we have trained professionals that work in multiple different settings: law enforcement, child protective services, victims services, and medical team, all who come together to work with a child and a family who's experienced something like this. So we know that the Children's Justice Center is a resource that people can use and benefit from. Primary Children's, obviously, we have our program, which is the Center for Safe and Healthy Families. We offer not just medical services, but we also have the important part, which is the therapy that happens for children who've had something like this happen. So we have evidence-based therapists who are available to provide services to children. And then the important thing that I really want to remind people is that children rely on adults in their lives to keep them safe. If they have the misfortune of having somebody in their life who's hurting them, you may be the adult that's going to keep them safe. So when a child shares something with you, really understand that they're giving you the opportunity to make a difference in their lives. And if you don't take that opportunity, if you don't do the right thing and call CPS, you could be leaving that child in a really dangerous situation that could impact them forever.
I think that's some really good advice and some great resources. And just so everyone has those, the Child Abuse Neglect Hotline, that phone number is 855 323 3237. Or, like you mentioned, you can also call your local law enforcement. The Primary Children's website is primarychildrens.org/safe and healthy families. And there's also a website, which is howtopreventabuse.org and pcautah.org as well. Dr. Laskey, thank you so much for joining us. I appreciate this candid conversation, and we'll talk to you later.
Thanks for having me.